Panic and anxiety attacks both cause a rapid heart rate, shallow breathing, and a sense of distress. However, they typically differ in severity and cause. Panic attacks are often more intense and can occur with or without a trigger, while anxiety attacks are a response to a perceived threat. People often use the terms panic attack and anxiety attack interchangeably, but they are not the same. These types of attacks have different intensities and durations. Symptoms of anxiety have links to mental health conditions, including obsessive-compulsive disorder and trauma, while panic attacks mainly affect those with panic disorder. Because the symptoms are so similar, it can be difficult to distinguish between panic and anxiety attacks. What are the signs and symptoms? Anxiety and panic attacks have different symptoms. Panic attacks come on suddenly and can occur with or without an identifiable trigger. Symptoms include a rapid heart rate, chest pain, sweating, shortness of breath, feel a loss of control. Panic attacks tend to last for 5 to 20 minutes. While panic attacks come on suddenly, anxiety symptoms follow a period of excessive worry. Anxiety symptoms may become more pronounced over a few minutes or hours. They are typically less intense than those of panic attacks. Anxiety attacks are not a diagnosable condition. However, symptoms of generalized anxiety disorder include nervousness, irritability, increased heart rate, and so on. Anxiety symptoms often last longer than the symptoms of a panic attack. They may persist for days, weeks, or months. But what causes panic and anxiety attacks? The exact causes of anxiety and panic disorders are unclear. People likely develop these disorders due to a combination of genetic, medical, and external factors. People may experience panic or anxiety attacks due to predictable or unpredictable threats. These threats may be real or perceived. A person may experience anxiety or panic attacks due to environmental stressors, chronic conditions, or chronic pain, overuse of stimulants such as caffeine. A 2019 study trusted source found that sexual minorities are more likely to experience GAD, although the prevalence varied by age group. Researchers classified any person that endorsed same-sex attraction, same-sex behavior, or identified as non-heterosexual as a sexual minority. Other studies found that LGBT and especially young people are twice as likely to experience anxiety or panic attacks as their peers. Women are also twice as likely to develop an anxiety disorder as men. Today's lesbian, gay, bisexual, and transgender youth come out at younger age. Public support for LGBT issues has dramatically increased. So, why do LGBT youth continue to be at high risk for compromised mental health? We provide an overview of the contemporary context for LGBT youth, followed by a review of current science on LGBT youth mental health. Research in the past decade has identified risk and protective factors for mental health, which point to promising directions for prevention, intervention, and treatment. Prior to the 1970s, the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders listed homosexuality as a sociopathic personality disturbance. Pioneering studies on the prevalence of same-sex sexuality and psychological comparisons between heterosexual and gay men fostered a change in attitudes from the psychological community and motivated the APA's removal of homosexuality as a mental disorder in 1973. Over the past 50 years, the psychological discourse regarding same-sex sexuality shifted from an understanding that homosexuality was intrinsically linked with poor mental health toward understanding the social determinants of LGBT mental health. Recent years have seen similar debates about the diagnoses related to gender identity that currently remain in the DSM. US and international studies consistently conclude that LGBT youth report elevated rates of emotional distress, symptoms related to mood and anxiety disorders, self-harm, suicidal ideation, and suicidal behavior when compared to heterosexual youth. That compromised mental health is a fundamental predictor of a host of behavioral health disparities evident among LGBT youth like substance use, abuse, and dependence. A recent meta-analysis reported that sexual minority youth were almost 3 times as likely to report suicidality. These investigators also noted a statistically moderate difference in depressive symptoms compared to heterosexual youth. In summary, clear and consistent evidence indicates that global mental health problems are elevated among LGBT youth. Similar results are found for the smaller number of studies that use diagnostic criteria, To measure mental health. Among sexual minorities, there are preliminary but consistent indications that bisexual youth are among those at higher risk for mental health problems. The general dearth of empirical research on gender and racial ethnic differences in mental health status among LGBT youth, as well as contradictory findings, indicates the need for more research. Specific research questions and hypotheses aimed at understanding the intersection of multiple identities are necessary to better understand diversity in the lived experiences of LGBT youth, and their potentials for risk and resilience in regard to mental health and well-being. But, what should we do during a panic or anxiety attack? First one. Acknowledgement. The symptoms of a panic or anxiety attack can be extremely frightening. Acknowledging the situation and remembering that symptoms will soon pass can reduce anxiety and fear. Second one. Breathing techniques. Difficulty breathing is among the most common and alarming symptoms of these attacks. Learning techniques to control breathing can help during an attack. Third one. Relaxation techniques. Methods of relaxation, such as progressive muscle relaxation and guided imagery, can reduce feelings of panic and anxiety. Fourth one. Mindfulness. Mindfulness helps people stay grounded in the present moment. It can be especially beneficial for people with anxiety who tend to worry about perceived and potential stressors. Various tips can help reduce the frequency and impact of panic attacks. When a panic attack starts, try not to fight it. Stay where you are. Practice slow, deep breathing. Try to visualize positive images. Remember that it will soon pass and that is not life-threatening. Learn about panic attacks and talk to others about the experience. Avoid substances that can contribute to the issue, including caffeine, tobacco, alcohol, recreational drugs, and sugary foods and drinks. Get regular sleep and exercise to reduce stress. Practice yoga, deep breathing, positive visualization, and other techniques for relaxation. Remember that it will pass. During a panic attack, it can help to remember that these feelings will pass and cause no physical harm, however scary it feels at the time. Try acknowledging that this is a brief period of concentrated anxiety and that it will be over soon. Panic attacks tend to reach their most intense point within 10 minutes of their onset, and then the symptoms will begin to subside. Find a peaceful spot. Sights and sounds can often intensify a panic attack. If possible, try to find a more peaceful spot. This could mean leaving a busy room or moving to lean against a nearby wall. Sitting in a quiet place will create some mental space, and it will make it easier to focus on breathing and other coping strategies.
Thanks for watching, and don't forget to subscribe.